Hi, thank you for coming in today. My name is Tina. I'm a pharmacist intern here at the pharmacy, and I just wanted to make sure. I have your name is Alex Jones. Is that correct?
Correct.
Okay, I just wanted to take about 5 or 10 minutes to talk to you about these two prescriptions that Dr. Smith has given you, just to make sure that you're on top of everything and understand everything there is, just so we can make sure your treatment is as good as it can be. So, Dr. Smith prescribed you doxycycline, 60 of these tablets, 100 milligrams strength, and so it'll be for 30 days with 2 refills on them. And he also prescribes you a NuvaRing, which is also known as vinyl estradiol and etonogestrel, and you'll get 3 of these, which will last you 3 months, and you have 1 refill on them. So the doxycycline, do you have any questions? Have you taken these before?
No, I have. I've taken the NuvaRing, but not the doxycycline.
Okay, you haven't taken the doxycycline. Okay, if at any point you have any questions, just be sure to let me know. What did Dr. Smith let you know about the doxycycline?
Nothing, actually.
Nothing? Okay, so this is the drug of choice to treat your acne, acne vulgaris, and so this is an antibiotic, and you may feel like you have feelings of nausea after you take this, so you'll want to eat this with food to prevent feelings of nausea. You will be taking 1 tablet by mouth twice a day, so you can take it like at 8 in the morning, 8 in the evening, just like with breakfast and dinner, something like that. And you want to make sure you eat this with 8 ounces of water, so just a glass of water, and then sit up for 30 minutes after you take it to reduce any irritation in your GI tract, so to prevent any burning that you might feel. So also you want to store this at room temperature, away from like light, moisture, heat. You might also experience like diarrhea if you take doxycycline. And just to make sure, have you ever had any hypersensitivity to doxycycline or tetracycline?
No.
Okay. If you find that you ever have any feelings of like you feel like you can't breathe or you find that you're swelling, then make sure to call emergency services right away because that should not be happening for this. Also, do you plan on becoming pregnant at any point? Okay, good. So this is definitely not a medication you want to take if you will be getting pregnant at any time, but I do see that you have the NuvaRing too, so just make sure you take that properly as well. So what kind of questions do you have about the doxycycline so far? Okay, could you please just make sure to let me know, repeat for me, like when you're supposed to take this?
Twice a day?
Yes.
Morning and evening.
Okay, and do you eat it with food? You do eat it with food.
Okay, you do. Okay.
Okay. And how long do you sit up for after you take it? Just to make sure.
Just say half an hour.
Yes. Okay, that's good. So the other medication that your doctor gave you is NuvaRing, and I saw that you've had this for a while, right, on your profile? Okay, so we'll just go over it really quickly again. Do you have any specific questions about this? Okay, so it is a contraceptive, and you do have to make sure it's better if you don't smoke while you're having it. So make sure to remember to keep it refrigerated, and before you use it, you have to wash your hands and don't touch the ring when you remove it. And you do want to keep the pouch so that you can, for disposal purposes, after you're done with your 3 weeks. So you want to keep the ring in for 3 weeks, right, and then remove it for 1 week, and then repeat every month. So if the NuvaRing does fall out, make sure you rinse it with cool or warm water, not hot water. And if it's been out for more than 3 hours on your 3rd week of having it, then you'll just have to discard that ring and use a completely new ring so that you can start the cycle again. Since you've been using it for I think it was 4 years or so, you've never experienced any like adverse reactions to it? No? Okay, that's good. If you are at high risk of like cardiovascular events, like if you have issues with your heart or anything like that, you do want to be careful with this. And also, the NuvaRing may cause you to experience like headaches or mood changes. So I do see that have you been having depression for a while or anything like that? So make sure if you ever feel like your mood changes or you feel like something's different, then make sure to let us know so that we can try and look at different options. So for both of these, if you ever miss a dose for like the doxycycline, just take it as soon as you remember and then get back on schedule. NuvaRing, if it's like within 1 or 2 weeks and it's only fallen out for like 3 hours or so, just so you can insert it after you've washed it. For the NuvaRing, could you please repeat back to me some of the important points that I mentioned?
You said you have to leave in for 3 weeks and out for 1 week, right?
Okay, yeah. Okay, and how would you what would you do when you're taking it out of the pouch?
I have to make sure I wash my hands prior to inserting it.
Okay. And remember to keep the pouch, right?
And keep the pouch.
Okay. So what other questions do you have for me today?
None.
Okay. Well, thank you very much. And if you have any questions whatsoever, just make sure to call us at the pharmacy.
Sure.
Have a very nice day, Mr.
Thank you. You too. Thank you.
See you.